In the bustling city of Baltimore, Maryland, in the late 19th century, a revolutionary idea was born. This was the era of rapid industrialization, where progress and innovation were the driving forces of society. In this dynamic landscape, one man stood out, a visionary philanthropist named Johns Hopkins. A self-made millionaire, Hopkins was deeply moved by the plight of the sick and the dying. He envisioned a hospital that would challenge the status quo, a beacon of hope in a world where healthcare was still largely in its infancy. His dream was to establish an institution that would not only provide world-class medical care but also foster research and education. He sought to bridge the gap between academia and practice, to create a center of excellence that would lead the way in medical advancements. The challenge was immense. The medical field was rife with quackery and superstition. The majority of doctors were self-taught, with no formal training or education. The concept of evidence-based medicine was still a distant dream. Undeterred, Hopkins turned to the esteemed surgeon and scientist, Dr. William Halsted. Recognizing the potential of this vision, Halsted agreed to become the first chief of surgery at the proposed hospital. Together, they set out to create a hospital that would redefine the face of medicine. Construction began in 1883, with the hospital's grand opening in 1889. The Johns Hopkins Hospital was unlike anything the world had seen before. Its state-of-the-art facilities, rigorous training programs, and focus on research and education quickly drew attention from across the globe. The hospital's first patients were met with a comprehensive approach to healthcare. Doctors at Johns Hopkins were expected to not only treat symptoms but also to understand the underlying causes of diseases. This holistic approach was a stark contrast to the traditional view of medicine, which focused primarily on relief of immediate symptoms. The hospital's success was not immediate. Critics abounded, questioning the need for such an institution and the validity of its methods. However, the hospital's unwavering commitment to excellence soon silenced its detractors. Over the years, Johns Hopkins Hospital became a hub for medical innovation. Its doctors made groundbreaking discoveries in fields such as anesthesia, radiology, and surgery. The hospital's research department grew, attracting some of the brightest minds in medicine. The impact of Johns Hopkins Hospital was far-reaching. It set a new standard for medical education and research, inspiring the establishment of similar institutions around the world. The hospital's emphasis on evidence-based medicine and its commitment to continuous learning and improvement continue to shape the field of medicine today. In the grand tapestry of history, the founding of Johns Hopkins Hospital stands as a testament to the power of vision, determination, and the relentless pursuit of knowledge. From its humble beginnings in Baltimore, it has evolved into a global leader in healthcare, a shining symbol of progress and hope in the face of disease and illness.